Strongly recommending to all of our residents that in order to protect yourselves and to protect others, you should consider when you're in the public to follow the CDC guidelines of masking up. We are trying to slow the spread of the virus here within our community, and that is our ultimate goal. Here within Orange County has now tested over 7,200 individuals for the COVID-19. Of those tested, about 744 have tested positive with the coronavirus. That is a rate of just above 10% of those being tested have tested positive within Orange County. We have 8 individuals who have died of COVID-19, and it has touched our Orange County employee, our family, if you will, within Orange County government, and in various ways. We have a number of first responders who have tested positive for the virus. We have a senior county official who has tested positive for the virus itself. So we know that it is real. It is something that can touch us very quickly in various ways. 3 weeks ago today, on March the 16th, there were 4 cases. Think about that for a moment. Just 3 weeks ago today, on March the 16th, there were 4 cases. At the rate these numbers are growing, I anticipate that by the end of this week, Orange County will have over 1,000 cases. Over 1,000 cases right here. I want to call to your attention the heat maps. Once again, we have endeavored to put them out every few days to update. The biggest hot spot in Orange County is in 32822, the 32822 zip code with 51 cases. There are 75 combined cases between zip codes 32837 and 32824. We ask that you remember that this is just a snapshot of how things look today. These maps can and will change over time. We cannot become complacent and let our guard down. Now is the time for us to stay isolated, continue with our social distancing so that, again, we do not spread the virus. It is imperative that we join together while we are staying apart to get rid of this virus in our community. That is the theme that you hear across the nation. That is the theme that you hear across the globe. Just moments ago, I saw breaking news that the Prime Minister there in the UK had been hospitalized and in intensive care. So we know that this is a deadly virus. This is a serious virus that we're dealing with. I want to talk about our Board of County Commission meeting tomorrow. The meeting in order to comply with CDC guidelines and keep our citizens safe. We will conduct all of our meeting proceedings tomorrow virtually. That will be the first time that we have done the entire Orange County Board of County Commission meeting virtually. We are committed to providing alternative platforms for the public to have the opportunity to submit any comments. We ask the public who may be interested in submitting comments to the board regarding the meeting tomorrow to do so at public comment, public.comment@ocfl.net, public.comment@ocfl.net by 5 p.m. today. County staff will read your submission and add it to the public record. If you want to make your public comment in person, you can come to the first floor of this building, County Administration, and there will be a virtual setting for you to be able to do so. Yesterday, in partnership with Visit Orlando, we launched what we are calling 407 Day. 407 Day to support our local restaurants through these challenging times. We're recognizing tomorrow, April the 7th, which represents the long-time area code that we've had here of 407. We want to keep the promotion going through the whole month of April and are asking for your support. Restaurant owners and their employees are working hard to continue serving our community delicious meals that are safe and conveniently distributed for all of us. We encourage you to order takeout or delivery from one of the many restaurants listed at visitorlando.com/to-go as you are able to do so. We also encourage you to spread the word tomorrow by posting your takeout photos using the hashtags hashtag 407day, hashtag 407day, and hashtag Orlando to go. That's Orlando to go. I plan to do so, and I hope you will join me in that effort. We know that restaurants are vital to our overall food chain and is keeping many of our small businesses open and their employees working. So please support that sector of our community. We have spoken about the generous spirit of our community during this time. I wanted to share with you that we had a local business who has donated personal protective equipment to Orange County. Spectrum News 13 helped to coordinate a donation from Orlando-based Fiddler's Roofing Company. The local business with 25 employees generously donated 175 N95 masks and 150 procedure masks to our Health Services Division. Thank you to Fiddler's Roofing Company. I'm happy to report that this protective gear is getting in the hands of our law enforcement officers to protect them while in the field. Fiddler's Roof also donated masks to the ER team at the East Orlando Advent Health Campus. Thank you again for supporting us during these difficult times. At this time, I'm going to ask Mayor Dyer to come forward and share comments with you. Mayor Buddy Dyer.
Thank you, Mayor Demings. These are certainly uncertain times for each one of us, for our community, our country, actually the entire world. One thing is certain, we now have a new normal, and it's uncomfortable. It's uncomfortable wearing these masks. It's uncomfortable staying at home. But it's necessary if we as a community are going to stop the spread of this virus. Our local hospital systems are projecting that we'll see a surge and then the top of the curve sometime probably in early May, and then we'll have the other side of that. We need to come down. So this is our new normal for now. And we don't like it, but we're all used to it for now. And our new normal means, and we've repeated these, I bet you can tell me exactly what I'm about to say, stay at home. This is our strongest tool to protect ourselves and our families and our neighbors. Go out only when it's for an essential reason, and necessary trips for food or for medicine or for takeout on 407 day. And when you go out, continue to physically distance yourself. Use that 6 feet. Wear a mask. I agree with Mayor Demings. We've reached that point where everybody needs to wear a mask. You're not only protecting yourself, but you're protecting others from you in the event you've come down with the virus and don't know it yet. It's easy to look at the new norm and only see what we're missing out on and not able to do. But instead, I'm going to suggest that you recognize that we've all been given the power, each one of us, the power to combat this virus and save lives. Every single one of us have an opportunity to be a fighter in defeating this virus. And it may seem like we're not in control of this pandemic, but we are. Staying home empowers us, empowers every single person in Orlando and Orange County to help save lives. And that's right, staying home empowers us to save lives. Now we're going to hear from Dr. Pino, and he has given us numbers on who's tested positive, those that have been hospitalized, details on residents who've lost their lives. But these aren't just statistics. These are people. These are people with families. They're people with friends. They're your coworkers and they're my coworkers. So we all have the power to make sure that others aren't infected, that loved ones aren't infected, that you're not infected. When I updated you last Friday, I let you know that another one of our firefighters had tested positive, and we have one more, so that brings us to 3. And as a precaution, 12 members of the department are under quarantine. Additionally, we talk about other frontline workers. Our transit workers continue to provide critical transportation services for the workers that are still working. And today, Lynx confirmed that one of their bus operators also tested positive for the virus. This employee is self-isolating and not working at this time, and we don't believe that he's affected anybody else. As you can see, our first responders, our healthcare professionals, our frontline employees continue to remind us of the importance of staying home. And we're so grateful to them and recognize their commitment to our health and our well-being. To showcase our community's collective heart and strength, we are going to turn the Lake Eola Park fountain lights red tonight in honor of all those frontline workers. Our entire community has rallied behind our heroes on the front lines. Today, we received another donation of critical supplies. Universal Orlando has donated 3,000 rain ponchos to the city to utilize for our medical responders in the fire department in place of gowns. And what's great about that is, unlike the gowns, we can reuse these, we can decontaminate them. So we thank Universal for their efforts and others who are doing tremendous things in our community. Again, I can't state this enough. The best way we can say thank you to our healthcare professionals and first responders is simply by staying home. So it's showing that we are in control of the spread of this virus. With that, I would like to introduce Dr. Martinez.
Good afternoon. Thank you, Mayor. Okay, one of the difficulties of wearing masks nowadays. I just wanted to reiterate a little bit of what Mayor Demings mentioned about the numbers. Last Monday, many of you might remember that our cases, our positive cases, were at a little over 300. As the mayor mentioned, right now there are over 700. So for those of us that might be doing the math, might recognize that we are doubling. So in a week, we doubled the number of positive cases. In a week, we doubled the number of deaths in our community. And as the mayor's mentioned, these are members of our community that we have lost. We have lost forever because unfortunately, they had an encounter with the coronavirus. We need to continue to protect ourselves. According to recent studies, and we keep remembering this and reminding everybody of this, there are individuals that are asymptomatic. That means that they do not have symptoms that we tend to recognize with the coronavirus, that meaning flu-like symptoms, fever, but yet they carry the virus and they're shedding the virus while they're carrying it. And then there might be individuals that are pre-symptomatic, and those are individuals that will eventually develop the symptoms of the virus. They're carrying the virus. They do not know that they're carrying it, but they're shedding it. And unfortunately, unbeknownst to them, they might be shedding it on individuals who have compromised immune systems. So that is why we might sound repetitive, but we need to remind everybody that we need to continue to wear masks, practice social distancing, and the best way to practice social distancing right now is by staying home. Staying home as much as you can. If you need to go out, stand at least 6 feet apart or more if you can from a person who's standing next to you, and or wear a mask. If the numbers continue to increase, as I was mentioning earlier, next week we might be at double what we are today. So we're looking at 1,500 people. The week after that, it could be 3,000. So by the time we reach our peak, which is being predicted to be the last week of April, perhaps first week of May, we may be in the thousands. And heaven forbid, if the deaths continue to double as they have so far, we might have lost more of our community members. So we need to stay vigilant. We need to continue to do the things that we know are the right things to do for ourselves and for our community members. Along with the recognition that Mayor Demings did of some of our community members that have provided in unison with companies some of the supplies for Orange County employees is also Motion Industries donated 2,000 dust masks, 188 boxes of gloves, and 4 gallons of bleach. And there's an individual in the community, a resident. Her name is Andrea Reese Hayes, who is a part of the Million Mask Challenge, a Facebook group that she has sewn herself and donated 17 masks. And these masks went to the Orange County government employees who are working directly with the residents who need rental assistance. And she's right now in the production of another 33 masks that she will again donate to Orange County employees. And we're very thankful to that, Andrea, and to the team at Motion Industries that provided those supplies for the team. And in continuing to talk about masks, we also want to send our public to our website, www.ocfl.net/coronavirus. And there you will find a very helpful video from our U.S. Surgeon General who describes how you can make a homemade mask if you are not able to get one of the bought or make one, sew it, etc. It's very simple. With 2 elastic bands and a piece of cloth, you can make a mask that you can wear out if you need to go out. And with that, I'd like to turn it over to Dr. Pino. Thank you.
Good afternoon. As the mayor mentioned, both mayors mentioned, I think that besides the fact that we are offering these numbers that seem at times overwhelming, it's important to know that we have control over these and that we should exercise as much control as we can to keep those numbers as low as we can. That's the battle right now, to keep those numbers as low as we can. As the mayor mentioned, 744 people have been tested positive. That continues to keep us at a 10% positive rate. And we have tested a total of 7,803 individuals in the county so far that we have count of it. And there are 12 awaiting results right now. Now, there are a couple of numbers that are important to watch when you look at the epidemic. Although the number of new cases is also important, it will continue to increase as we receive more test kits and continue to do that in the community. The number of hospitalization is a very important number, as well as the number of people who have died, unfortunately. But those are numbers that are going to indicate to us how deep and how grave the situation is, and how well are we dealing with the situation, and also how well are we controlling the situation, if we want to say in that specific way. With the numbers, let me explain to the public, when we say 744 positive number, it doesn't mean that 744 persons are positive right now that we know. It means during the entire course of the epidemic, those are the many people that we have identified. The numbers in reality could be a little bit different. As capacity increases for testing, those numbers will continue to increase. The same applies for the number of hospitalization. That means 89 people have been hospitalized in total. And the same applies, of course, for the number of deaths. The 2 individuals who recently died on April 2nd, both of them. An Afro-American male, 81 years old, with pre-existing conditions. We think that it was acquired in the community. And a 70-year-old Hispanic male who we believe had acquired it during a trip to Italy. No pre-existing health conditions in the case of the Latino individual of the past, and our condolences are with their families and everyone who is suffering from this pandemic. We have taken several steps at our department. We continue to provide the same services that we have, or we provide, just in a modified form. We continue to see patients to telehealth. And please, during these hard times, if you are pregnant, if you are in postpartum, and you have a baby who is younger than 5 years old, we have WIC for you. And you don't have to even come to the office. Call our numbers and we will certify you by phone. The number for WIC is 407-858-1494. Thank you. I always forget to introduce Sheriff Mena. Sorry, Sheriff.
That's all right. Good afternoon. Thank you, Dr. Pino. So today I wanted to tell you about a special team that we have activated at the Orange County Sheriff's Office to help our deputies deal with the increasing threat of coronavirus. So within our emergency response team, we have groups of deputies that are highly trained and specially equipped to deal with biological threats such as we face with coronavirus. And so if you think about it, these are the same deputies who respond to meth labs or houses that may have fentanyl or heroin in them that have been deadly to us before. So we've created 4 of these special response teams that will be available 24/7 to respond to any known or confirmed COVID-type call or any incident involving a higher level threat for the virus exposure. They are especially equipped with clothing that is impermeable to biological threats, and they, of course, have air purifying respirators, otherwise known as gas masks. So we just want to ensure as best we can that both for our deputies and the community, we are protected from the threat of coronavirus. The deputies assigned to these teams will have more time to decontaminate themselves and their vehicles, thus leaving our regular patrol deputies free to continue to patrol and keep our community safe. And so just on that, the deputies, the Orange County Sheriff's Office, and all the Central Florida law enforcement on the front lines, they are proud to be out there protecting this community, and they're working hard for you at threat to their own lives. So we want you to work hard for them and stay at home. So again, the vast majority of residents and businesses, I think, are adhering to the stay-at-home order, but we still are responding to groups and large gatherings. People who are violating the social distancing, and we just need your help. So we need to do everything that we can together to stop the spread of this deadly virus. And so in law enforcement, we always talk about body armor and protection. So the best protection for all of us is the distance from each other, and to stay away from each other, and to stay at home. So we're asking everyone, again, to please adhere to the orders, stay at home, don't go out unless you absolutely have to. And as we are approaching Easter, I want to take a moment to remind our religious leaders that although the religious gatherings are exempt from the executive order, we are asking, please, that you practice good social distancing at your gatherings if you choose to have them. We prefer that you do those virtually or not at all. I mean, this is going to affect our community, so we're asking this of our religious leaders or any other way that they can help us prevent the exposure to large groups of people. Thank you. At this time, I'll introduce Chief Judge Myers.
Thank you, Sheriff, and thank you, Mayor. Good afternoon. During this crisis, we continue to limit courthouse access to only proceedings that are essential and critical to a state of emergency or to the public health emergency. The court continues to be committed to the health and safety of all of our court users, and if you are in the court building, we do exercise social distancing and encourage, in fact, enforce groups of less than 10. Today, the Florida Supreme Court issued a new administrative order extending the time for our limited court closures. When I was here with you Friday, I told you that that date was through April the 17th. The court has now extended the temporary and limited closure of the courthouse through May the 29th. We mail out summonses to prospective jurors about 5 weeks before their service. We've continued to do that. So if you've received a summons to report for jury duty between now and May the 29th, your service is complete and you will not be summoned again for a minimum of 12 months. You're excused from jury duty. We will continue to have limited access to the courthouse through May the 29th. There are, however, essential or critical proceedings that must continue in a face-to-face format. We encourage you first, stay at home. But if it is essential, and you have a proceeding that falls in this list of essential proceedings, you may come to the courthouse. First appearances, criminal arraignments, hearings to set or modify bail, juvenile delinquency hearings and shelter hearings, hearings on petitions for injunctions related to your safety, hearings on petitions for risk protection orders, Baker Act, Marchman Act, and guardianship hearings, and finally, any hearings on petitions for extraordinary writs that are necessary to protect constitutional rights. Critical proceedings, we are also handling those that are related to the state of the emergency that we're in currently. So if we have cases involving a violation of quarantine or isolation, violation of orders related to limit travel, violation of orders to close public or private buildings, or enforcement of curfew, those are all proceedings that we continue to handle at the courthouse. As the sheriff has reminded you, please stay home, and none of those things become necessary. Many of our non-essential processes are continuing remotely. If you're involved in one of those, you'll receive a notice to that effect. And we are doing everything that we can to continue to keep you updated. You can access the court's website at ninthcircuit.org or follow us on Twitter or Facebook at Ninth Circuit FL. This time I'll invite the Orange County Comptroller, Phil Diamond.
Thank you, Judge Myers. You know, in normal times, my office would issue a press release about this time and let everybody know how we did with our tourist development tax collections. I think, as you know, these are not normal times, so the reports can be a little different this month. The good news is that for the month of February, we were up about 6.8%. And in fact, for the year to date, our fiscal year, we're actually up close to 8%, which is a really, really good result. But like I said, these are not normal times, and the positive results from February don't reflect the realities of March and the months to come. As you know, the virus has led to the closing of our theme parks. Many of our hotels are closed or reporting very low occupancy rates. And many people around the community, our neighbors, and many people around the world who would be potential travelers just aren't going to travel now, at least not for a while. And many people have unfortunately lost their jobs or suffered health issues as well. But to give you some kind of historical comparison, after 9/11, we suffered about a 32% decrease in tourist development taxes in that first month. For the next 11 months, things continued to decline. But after that, things turned around. So over the first year, we were down by about 13%. Then the following year, we were up by about 2%. And then the year after, we had record collections. So I think my message is things will get better. They always have. In the meantime, we're going to carefully monitor our reserves and our TDT financial issues. My office, my predecessor, Martha Haney, and I have always advocated for responsible budgeting and strong reserves. And with the support of our mayors and our boards of county commissioners, the county has done that. We have strong reserves. I'd also like to announce that taxpayers will have an extension of time to file their TDT tax returns this month for March. Typically, they would be due on April 20th. They will be extended to April 30th. At this time, I'd like to ask Mayor Demings to come back up.
Okay, we'll open it up for questions, but I guess if you had to sum up what you've heard at this point is things are going to get worse before they get better, but they will get better. And that's what we are being patient about. That is what we are praying about during this holy week of weeks. Okay, with that, if there are any questions, remember kind of the rules that we go by right now is if you ask a question, we'll try to have everyone that has a question for that particular speaker to ask the questions while that speaker is here at the podium. Okay, first question.
Mayor Demings, Ryan Gillespie at the Orlando Sentinel. I'm not sure if this is best for you or for Dr. Pino or both of you. There was a model that's a statistical model out of the University of Washington showing statewide that our peak had moved up by their calculations to April 21st. I know you've seen some local data or talked to the hospital systems with local data. Has that data changed at all in recent time to match this Washington model?
Well, I think you're referring to the Institute of Health Metrics and Evaluation. I'm aware of that model. However, I will tell you that we do have hospitals here in our area who are now really analyzing the data that's unique to our region. and midweek this week, they are working on a predictive model that will be used to validate what has been done by this national organization. Whether it's the 21st or sometime thereafter, we can't say with certainty, but as you've heard us say on a number of occasions, we are planning for the worst and hoping for the best, but it is important that we have data to make those decisions that we need here within our community. We work in close partnership with the Florida Department of Health as well as our other healthcare providers, since this is a healthcare crisis, to understand when they potentially will see a surge and meet or exceed the current capacity within our hospital systems. We're planning for that. And so this week, again, is a pretty critical week for us to understand what will happen in the succeeding week or two. We do know that if the 21st is the date that we will peak, that means that it will then begin to level off after that. Perhaps in some ways, the sooner we peak, the sooner we can begin to recover. But all of the efforts that we talked about today are designed to mitigate that peak, because we don't know with certainty. We are just hoping that many of the provisions that are being put in place now will minimize the width of that peak or surge within our community. The sooner we can minimize that, the sooner it'll start coming back down to some place of normalcy for us. So, Dr. Pino, would you like to add anything to that?
No, you did very well. I may have to be careful with my job. So the thing with modeling is that it will change every time that you enter new data. And that's why the models are constantly updated. So what is important to know is that we are going to be peaking at the end of April. And also it's important to know not to let our guard down when we peak. Other places have seen multiple peaks, and it has to do in part with relaxing those social distancing measures and other measures that have been in place when we will announce in the future, because we will announce it, we will get there. We will get to a point that we say, the numbers of cases are declining and we are in a better place. But at that point, we even have to be stronger about those measures, because if we relax, then we will have multiple peaks.
Any other questions for Dr. Pino while he's there?
Actually, I do, Mayor, if you don't mind. Dr. Pino, Greg Fox at West TV. I notice as I'm going around to various stores that they're all over the place as far as the 6-foot rule and how many people they let in. And I'm wondering if there needs to be a time in which there's a specific number of people per square footage, and if that's something you can even enforce in this county.
So what was suggested was for places to reduce the number of people inside by 50% at least. And then you will see places like Walmart or Home Depot who are counting the number of people that are coming in and out so that they have a control over the flow. But more important than the number of people is the spacing between people. And that's what is critical. Of course, the more number of people that you have in a smaller space, the less likely you are going to have the sufficient space for that distancing. But most places have tried really hard to do it. They have marked the floor. So many places have taken these behind the guidelines, which is good.
Dr. Pino, can you explain what goes into how you determine when the peak is? And the National Task Force has said these next 2 weeks will be critical in containing or spreading this virus. Can you explain why that is?
So the virus has a 2-week cycle of transmission, more or less, but that's the standard. Most people get affected or get symptoms by day 5, but then you isolate for the rest of the 14 days. So the next 2 weeks are critical as our number have increased, and they tend to double every 3.5 days. So we can foresee that if we haven't peaked yet, we are going to see our numbers in the thousands. So that's why the next 2 weeks are critical. We have a 30% ratio of positive cases. That will be important to watch, see if it change the percentage. We will be watching that. That's another interesting number, because if you continue to do the same number of tests and the rate decline, that means we may have some control as what happened in the community. So the numbers are complicated to explain on TV, but that's an interesting number to watch, the percentage of positive rates that we will see in our community. That's why those next 2 weeks are so critical.
Doctor Pino, Félix Pirela de Telemundo, una respuesta interesante que ha dado usted, pero queremos para nuestra audiencia hispana en español ese mensaje. El cirujano general de acá de Estados Unidos ha dicho que la semana más crítica de esta pandemia va a ser esta semana. Y bueno, queremos saber cuál es el pronóstico que ustedes tienen a nivel local, tomando en cuenta sobre todo para la audiencia hispana de 32822, el zip code acá en Orlando y el condado Orange, que la mayoría de las comunidades que están en Salida Park, La Seymour, Golden Rose son hispanos. Un mensaje para ellos y, por supuesto, ¿cuándo ustedes creen que será este momento más crítico?
So, nosotros, yo no estoy seguro de que para nosotros la próxima semana será la más difícil. Yo pienso que es la semana después de la próxima. La semana precisamente antes de llegar al pico. El cirujano general se estaba refiriendo de manera general al país. El alcalde estaba diciendo de los análisis específicos que estamos haciendo para el condado. Nuestro condado parece que está un poquito detrás de otros lugares como Miami, Broward o Palm Beach, que Miami tiene 4,000 casos. Entonces, estamos un poquito atrás y estamos mirando qué está pasando en Miami para saber qué va a pasar acá. Con eso, lo que quiero decir es que los datos son importantes y esperemos que las próximas 2 semanas van a ser difíciles.
Lauren Seabrook, Channel 9. Dr. Pino, when we see the number of positive cases locally and statewide, does that always include all of the private labs? I know you had talked about at one point there was some lag time. Now that we have more and more testing happening, are we including all of those numbers?
Yes. Every single lab have to report electronically to the state either daily or twice a day all their results for diseases that are considered to be mandated reporting.
Dr. Pino, Ryan Gillespie at the Orlando Sentinel. 89 hospitalizations, you said. What do you take away from that number out of 744 or so positive cases? Is that kind of what you would expect, or is that more or less?
It is a little bit high for the number of cases that we have, although our number of cases has increased at a higher rate than our rate for death. So that's, I will not call it positive news, but it is hope. It gives us some hope that is the cases that are getting affected are not ending with such a negative outcome to putting away. But it's still important. It's still important that out of 744 people, 8 people have died.
This is Steve Hudak from the Orlando Sentinel. This is for Mayor Demings. Mayor, on Friday you talked to us about a possible regional approach to trying to turn back or break the backbone of the virus, as you have said. How would things be different under a regional approach as compared to what we're doing now?
I think one of the things that you will see during the period of a surge is the response from the hospital systems within the area, and the ability of our region to be able to respond to it effectively. We have to look at the market for the hospitals here in the area, and the hospitals are not just based on county lines. And so because of that, I know that the available beds, the available ventilators, the available healthcare staff that would be responsible for the treatment of those who test positive for COVID-19 who need to be hospitalized, they're within those systems. And so that is why it is absolutely critical that we work with the local hospitals to be able to understand what their capacity is, and it's tied to the rate of infection here within the community, the available hospital beds, the available equipment, the available healthcare staff here within this area. If we surpass our capacity, then we need additional resources. And those resources can mean the need for having an alternative hospital location that could be a place where individuals who may be non-COVID patients will need to be housed in order to allow the hospitals to have the most severely impacted patients hospitalized. So that is kind of the thinking, the regional thinking that we are having that dialogue with and looking again at the data that we're seeing here within our region. So we are still in the midst of trying to plan for that and understand it and validate it by our own set of metrics here in the area. Okay. Other questions?
Mayor Demings, Curtis McLeod with Spectrum News 13. Based on your conversations with the hospitals in Orange County and the partnering hospitals in the county, do you feel as if these hospitals are prepared to take on the influx of patients they'll see during this time where we're seeing peak cases?
What I've been told by our hospitals is that in terms of the current demand for beds, they're able to meet that capacity. With the critical care units, I've seen numbers as high as they're at 60% of their capacity today. So understanding the math behind the growth, the spread of the virus in our community is crucial to understanding the demand for the hospital beds. We are working with the state, and the state is working with the federal government so that when we hit that critical mass period of time, we want to have a plan that contemplates everything that is needed at that time. I'm reasonably confident that today, because of the level of experience and education and the spirit of cooperation that we have as a community, that we'll be able to deal with whatever is thrown at us. Okay. If we have perhaps one more question, two questions. We have one in the back and then one in the front. And then the one in the back is it for?
Yes or no. So I see that 2 hotels in Tampa are going to be operating as quarantine sites. Is that something that's been discussed in Orange County?
We have a hotel owner that has offered as a potential place to house a certain number of patients. We are looking at other facilities within our area, and depending upon that gap between the existing capacity and the surge capacity will drive which facilities here within our region are most appropriate. And so this week is going to be very critical to understanding that. But while we're trying to get the understanding, we're looking at various options here in this community based upon that gap in terms of availability. I didn't quite understand what you said. I won't say which hotel at this point because those negotiations are kind of being done one-on-one at this point. And so until contracts are actually signed, I don't think it would be appropriate for me to kind of say that at this point. Yes.
Mayor Demings, Jerry asking News 6. Has the hot zips or hot zones changed at all since last week, and is there a larger plan to address those areas?
This overall plan of action that we have is addressing those hot spots. In order to impact the hot spots, it's all about having the breadth of information, the knowledge, communicating with people in those areas, what can be done. I will tell you that peer pressure has been our friend in this process. You know, it is impractical for law enforcement officers to be everywhere to try to enforce the rules that have been put in place. In fact, some of the rules are simply suggestions. We urge you to do certain things. But what I see happening in our community, a tremendous amount of peer pressure where people within our pharmacies, our grocery stores, and restaurants and other places, they are policing, helping to police themselves. And that's really what you want to see in a pandemic. You want the populace to police themselves, to have the kind of self-discipline to be able to isolate themselves and adhere to the orders. And so that is something that I do see happening here within this community. And so we're very thankful for all of those who are adhering to the directives that we have put in place. We just have to constantly remind people why this is necessary. And so these press events are really aimed at helping to reinforce the message.
Mayor, we have a text question from Jason Delgado with Politico, Florida. To Sheriff Mina and/or Mayor Demings, how, if at all, are you coordinating with neighboring counties about health guidelines and enforcement? Is regional uniformity in tactics important to combat the spread?
Uniformity throughout the region is desirable. And I've had conversations with the chairs of the counties within the region. We have a conference call meeting scheduled where we will have that dialogue with hospital representatives on the line to try to come to more commonality as we plan forward.
Lauren Seabrook with Channel 9 again. For the folks who were approved for the rental assistance, do you have a timeline for them? Some of them are concerned they haven't heard from anyone of when they'll be receiving some money.
Okay, we have a dedicated staff now who have been working around the weekend included and many hours out of the day to try to meet the needs of those who have made application. So we have some 50-plus staff now who are working on that. In terms of the timeline, I would expect that if they have made the application within the next day or so, they should, at the very least, receive an email correspondence, if that's how they reached out to us, with further directions about the appointment time that would be necessary for them to bring in additional documents. If they made the phone call touch, they would have received specific instructions from that phone interaction about when they will be followed up with. When do I reasonably anticipate that we will go through the unduplicated 30,000? We had 30,000 or so calls into the phone line or through the electronic means, through email, etc. Unduplicated, that number is still fairly high, 19 or 20,000 unduplicated calls at the last update I received. So it'll take some time to get through all of them, all total, before we will say you're not eligible. Checks are being cut, and checks are being distributed directly to the landlords for individuals who have qualified. So we're honoring that commitment. At tomorrow's Board of County Commission meeting, there will be an update to the board by our Family Services Division and really by our emergency manager about our collective response to this pandemic, and there will be information shared about the crisis assistance program, and the board will give additional instruction from that point.
One last question.
I have a question for Phil Diamond, if that's okay. Mr. Diamond, you talked a little bit about what the February numbers looked like for TDT. We had some meetings and some tourism at that time. What is March going to look like?
That's a great question. And it's hard to say, Steve, because the closest thing I can think of that may be comparable would be 9/11. You also, though, you had the world's most popular theme parks closing down. And 75 million people a year come to this area to go to the theme parks and go to conventions, and there weren't a whole lot of conventions going on in March as well. So I think as far as the numbers, we'll know for sure at the end of this month when people file their returns. But I think it's important, really, as far as March or any other months, just to keep in mind, I think, the message that we've heard from everybody else, which is people aren't going to come here until they feel safe. And people aren't going to be safe until we do all the things we're supposed to do. And, I know that people often say, well, thank you for your leadership. But I'm very glad that Mayor Demings and Mayor Dyer came out in favor of the social distancing and enacted the orders that they did, because I don't think our economy gets back to where it is and people start getting hired back to their jobs until the virus is gone, till its back is broken, like Mayor Demings said. So I think when you can answer that question, you'll see. But I do want to emphasize that we do have strong reserves. That's why we have strong reserves, is for situations like this. Hopefully, we won't have to go very long, and things will turn around quickly. But time will tell. But in the meantime, I think this is probably a good time to advertise the social distancing and staying at home and all those things, because that's what's really going to turn the tide. Sure.
Para la doctora Martínez, en español, la zona más roja de acá el condado Orange es el zip code 32822. Doctora, la mayoría de esa población es hispana. Un mensaje de usted como especialista: ¿están monitoreando especialmente a esas comunidades hispanas, llevándoles, por ejemplo, información, recomendaciones, o monitoreando quizás los casos positivos que hay en el área?
Bueno, parte de la recomendación y de la información está viniendo, gracias a Dios, de tu canal y de la información que tú estás dando. Es importante que las personas reconozcan que la distancia, lo que estamos tratando, el mensaje que estamos tratando de dar es importante, que se mantengan separados, que se mantengan protegidos, que traten de mantener distancia el uno del otro. Seguir viendo las presentaciones que está dando el alcalde, los alcaldes de la ciudad y del condado es importante, e informarse, como tú has dicho en otras ocasiones. Es el mensaje que podemos darle. No sé si contesté tu pregunta.
Quisiera saber si hay algún tipo, por ejemplo, de las personas que necesitan hacerse las pruebas en esa área, ¿cuál es el punto más cercano que puedan acudir?
Bueno, tenemos 2 puntos y uno depende del criterio que se utilice. Uno es el Orange County Convention Center, que se están haciendo pruebas ahí, el gobierno federal está haciendo pruebas. También el otro punto es el Departamento de Salud. El doctor Pino ha dado en varias ocasiones el teléfono de las oficinas de él, el 407-623-5004. 723. 407-723-5004. Y las personas pueden llamar ahí, hacer una cita, y basado en el criterio que el Departamento de Salud tiene, ellos pueden hacerse la prueba. Yo creo que hasta ahora es el lugar más céntrico que tiene la comunidad hispana. Precisamente está localizado en Alafeya, cerca del 32822, para poder hacerse la prueba y recibir más información. Siempre pueden llamar al Departamento de Salud a esa línea, y esa línea les puede dar más información acerca del virus.
¿Y si puedo añadir? Los alcaldes todavía no saben de esto, pero estamos organizando targeted testing para algunas áreas en específico, y es muy probable que esa área esté incluida, por supuesto, en las áreas. Lo que estamos tratando de hacer, si contamos con los recursos necesarios, es ir a los lugares específicos donde existe una mayor concentración de casos y proveer testing en esos lugares. Y esa comunidad estaría incluida.
And with that, muchas gracias. Hasta mañana.